Hello everyone, this is Dr. Schumailla Bassi, MBBS and MS Obs and Gynec, working as consultant gynecologist at Cloudnine Hospital, Ludhiana. Colposcopy is an OPD procedure to see your cervix. Now, scopy means to see anything with an eye hole like that. For example, laparoscopy for the abdomen, gastroscopy for your food pipe, colonoscopy from the pipe from where you get your stool, etc. So colposcopy is a scope. It is an instrument. It's on a stand. It's like camera if you have on a stand. It is a similar instrument which has filter and lenses in it. Why do we need a colposcope? Any female complaining of vaginal discharge, foul smelling discharge, itchy vaginal discharge, irregular bleeding, spotting after having sex, or painful sex, such females are advised to go for an examination by a gynecologist, a Papsmear, and then a colposcopy examination. So it is OPD procedure, painless procedure. You come to the OPD department, we make you lie on the table. We examine your cervix first with the naked eye, and then we bring that instrument and bring it close to your vagina. And your gynecologist will go behind that instrument like we go behind a camera to focus. We focus your vagina, cervix and vulva, that means your outer skin of the vagina. Now, colposcopy has built-in lenses and lights which help your gynecologist to see that if any unhealthy area of the cervix is just a little unhealthy or really unhealthy, which basically means it helps her to detect any precancerous or cancerous cells, the cells which will later after a few years can convert into cancer and give you cervical cancer. Papsmear also helps you detect that, but Papsmear just gives an information about the cells of the cervix. But colposcopy helps us to view the cervix. We see the cells, we see the blood vessels, the stroma outside the cells, and it helps us to diagnose that do we really need to test that cervix by a biopsy. It also helps us to tell where the biopsy has to be taken. For example, if whole of the cervix is infected, we cannot take biopsy from the whole of the cervix, but if we see it with a colposcope, we can really know that right there is the abnormal cell and the abnormal vessel, and we should not miss out that area in biopsy so that we can really detect if you have any cervical intraepithelial neoplasia or any precancerous cells or maybe cancer. So colposcopy is a very important and helpful tool to know the health of the cervix. Mostly it does not have any side effects. You don't feel any pain, but if we put some solutions to view your cervix, then you can have little itching or little discomfort after the procedure, or you may have little irregular bleeding during that cycle but not later. Females having all these symptoms, or females having family history of cervical, uterine, ovarian or breast cancers, or females having a routine pap smear giving abnormal reports, or any female having HPV DNA positive in her pap smear, such females should definitely go in for colposcopy. And once colposcopy gives any positive report, meaning any abnormal cells, then you should go in for further treatment procedures like cryosurgeries, leap excision procedures, or even removal of your uterus.